Good morning. Welcome to Crisis Support Services of Nevada's 5th annual Compassion Through the Crisis virtual event. Thank you for sticking around for the technical difficulties, but we are live. I am your MC, Connie Ray. Thank you for joining us virtually again this year to highlight the invaluable services that Crisis Support Services of Nevada provides 24 hours a day, 7 days a week, 365 days a year. We have lived through unprecedented times. People are struggling. And today we will highlight the collaboration being done to develop Nevada's behavioral health response system. You'll learn how you can be a part of building a system that will support Nevadans and others struggling with a behavioral health crisis. I wanted to first thank you for joining us. We are grateful you're here today to learn how you can play a vital role in saving lives by simply supporting Crisis Support Services of Nevada. Not only helping those in crisis in our own great Silver State, but around our country. I would like to start by thanking our generous sponsors who made today possible. Thank you to Renown, NV Energy, Reno Behavioral Healthcare Hospital, and My Community Store. Thank you to our sponsors. Here today to present this year's welcome address for the 5th annual Compassion Through the Crisis, please welcome Senator Catherine Cortez Masto.
Hi, I'm Senator Catherine Cortez Masto, and I am glad to join you for this important event. The work that Crisis Support Services does in Nevada has been life-saving for thousands of people. And I want to thank Executive Director Rochelle Pelletier, the whole staff, and all the volunteers for helping Nevadans through all the mental health stresses the pandemic has caused, including for so many students. Your work has been critical. I appreciate your partnership as I work to address mental health issues across the state. As many of you know, I've been working to increase access to mental health care throughout my time in the Senate. I'm especially proud to have authored bipartisan legislation, the Behavioral Health Crisis Services Expansion Act, so that people facing mental or behavioral health emergencies can get the expert-tailored care that they need. I am going to keep pushing at the federal level to amplify what you all do here in Nevada. Thank you for your commitment to helping people at a dark moment in their lives and getting them that essential support.
Thank you, Senator Cortez Masto, for kicking off this morning's virtual Compassion Through the Crisis event. We thank you for your commitment to finding better mental health solutions for Nevadans and our nation. And we also thank you and your team for your continued support of the upcoming 988 Crisis Hotline rollout, which is coming in 2022. Here to present the State of Crisis Support Services of Nevada's update, as well as taking a look at where we are and where we're headed regarding crisis care in Nevada, please welcome Crisis Support Services Executive Director, Rochelle Pelletier.
Good morning. As Connie said, I'm Rochelle Pelletier, and I have had the privilege of being the Executive Director of Crisis Support Services of Nevada for almost 6 years now. I want to thank all of you for joining us so early in the morning for this 5th annual Compassion Through the Crisis. The Board of Directors and I are so pleased to have you here today to learn about Crisis Support Services of Nevada and those we serve. Crisis Support Services of Nevada has been saving lives for more than 55 years. The organization was established in 1966 in response to the high rate of suicide in Nevada. Working with the University of Nevada, Reno, and Northern Nevada Adult Mental Health Services, an all-volunteer 24-hour suicide prevention hotline was established. This was really quite amazing when you remember that in 1966 there were no cell phones and only one landline per family. Back in 1966, Nevada had the highest rate of suicide per capita, and we kept this unfortunate #1 position until the 2000s. Our first office was a phone booth in the UNR library. How many of you even remember phone booths? As I said, the organization started out as an all-volunteer hotline. Back then, volunteers took the calls at home. When the phone calls came in the middle of the night and there was a need to dispatch emergency personnel to help someone who was suicidal, The volunteer would send one of their kids or a spouse next door to the neighbor's house to call the police. That was before 911. In the first few months of operations, the need for our services proved to be so great, it was expanded to include support for any persons in any type of crisis. We have learned that people don't just wake up one day and think, I'm going to kill myself today. There are many different traumas and issues that lead to that kind of pain. In 1979, the center again expanded its services by adding an advocacy program for victims of sexual assault. We have been advocating for those who have been sexually assaulted in Northern Nevada for more than 40 years. Today, Crisis Support Services of Nevada still operates 24/7, 365. We operate with both paid staff and volunteers. Our funding is primarily through federal and state grants, so all services are free of charge to those who contact us. Now our diverse, well-trained and dedicated volunteers and staff members help those in crisis to make safety plans and dispatch emergency services to those at imminent risk, both in Nevada and all over the United States. Crisis Support Services is one of 9 national suicide prevention lifeline call centers. All calls to the lifeline from Nevada come to our center first. We also get the calls that roll over from the 170 other independent call centers across the nation when they are unable to answer all of the calls coming into their region. CSSNV was contacted by over 83,000 people in 2020 through both phone call and text message. We were one of the first crisis centers in the nation to implement a texting service for crisis intervention, immediately getting response from youth ages 10 to 24 who would not have called in for help but would text in a crisis. Of those 83,000 plus people we helped last year, over 4,300 were via text message. 20,000 of those contacts were from Nevadans. As I said, we take care of the whole state. 26% of those calls and texts were from Washoe County. 53% were from Clark County, 20% were from the rural counties, and 1% were from unknown areas in Nevada. We helped over 3,800 callers who were victims of current and or historic child abuse. We took 2,257 Child Protective Service reports last year. We helped almost 850 callers over 60 years of age and over 700 adults with disabilities who were victims of abuse and neglect, and took over 340 abuse reports. That is a lot of numbers, but let me put a face to those people who contacted Crisis Support Services of Nevada. It was the Carson City Middle School 6th grader who, after participating in signs of suicide, where wristbands, pencils, and stickers with our phone number were distributed, she told a counselor at her school that she had already called us 3 times, and that is why she is still alive. That one just hurts my heart as a mother. But thank God she called us. We know that teens will reach out if we give them our contact information, just like the Sparks middle schooler who reached out to us when she saw a Snapchat that 14 of her friends had a suicide pact and were planning to kill themselves the next evening. Because that child contacted us, one of our UNR social work interns was able to dispatch the appropriate people to help these children. It was the housekeeping staff member who worked in a New Jersey hospital emergency room during the height of COVID, who called because he had seen so much death and didn't feel like he could do it anymore. It was someone calling from Washoe County about an adult with disabilities who was being abused by his caretaker. The abuse was so great that not only did we take a report, but we dispatched law enforcement to have that caretaker removed from the premises. It was a Las Vegas man on the sexual offender database who called because he was offending again. We got that man the help he needed from Las Vegas PD, and he was taken into custody before the graveyard shift was over. It was also the 911 dispatcher who attempted suicide the day before and was still struggling. We were able to de-escalate her and then get her to safety with her adult daughter. Not all of the people we helped over the phone, sexual assault support services volunteers and staff advocates provided services to victims of sexual assault in Northern Nevada. Last year, our organization assisted 500 assault victims and their families. These services run the gamut from meeting with the victims immediately after an assault, dispatching the forensic nurse to do the exams of those who were sexually assaulted, being present and providing advocacy during the forensic exam, facilitating victim assistance, and following up with the victim for up to 6 months. We do our best to help the victims of these heinous attacks to not only become survivors, but hopefully become thrivers once again. This last year, we have been working very closely with the Nevada Department of Health and Human Services, law enforcement, and other first responders, as well as providers of behavioral health care to implement 988, the upcoming National Behavioral Health 911, and a statewide behavioral health care crisis response system. This behavioral health care response system saves lives by directing people to the appropriate services at the appropriate time in the appropriate place. There are 3 parts: the call center hub, where 988 calls will be directed, mobile teams, and crisis stabilization centers. Currently, if someone is having a behavioral health crisis and call center staff cannot de-escalate them, we send emergency personnel, mostly law enforcement. Law enforcement decides whether they will go out to help that person or not. If law enforcement does respond and that person still cannot be de-escalated, they transport the person to an emergency room, usually in the back of their cruiser and usually handcuffed. After transportation, the officer has to wait with that person in crisis, sometimes for hours before they are released back out to serve others in the community. The emergency room is left with a patient who may or may not really need that level of care. In the new system, if the call center cannot de-escalate a caller, then we will deploy a mobile team. If the mobile team cannot de-escalate the person, then that person is taken to a crisis stabilization center where they are never turned away and emergency personnel can immediately return to their duties. The best suicide prevention is to get people to the services they need before they are in so much mental pain that death seems like the only option. 988 in the statewide behavioral health care response system will save lives. Today you will hear from speakers regarding why we need this system, what specifically the system looks like, how Nevada is in the forefront in funding this vital service. I will leave you with a quote from John F. Kennedy. The Chinese used 2 brush strokes to write the word crisis. One brush stroke stands for danger, the other for opportunity. In a crisis, be aware of the danger, but recognize the opportunity. Nevada has an opportunity right now to collaborate so that we build a behavioral health care response system that will save lives. Crisis Support Services of Nevada has always been aware of the danger of losing our loved ones to the opioid and suicide epidemics that are ravaging our nation. But we also recognize the opportunity to work with all of you to help people to see that there is hope and there can be a better tomorrow. Thank you again for joining us today. We really appreciate it. Back to you, Connie.
Thank you, Rochelle, and thank you for sharing that very important data. Once again, proof that Crisis Support Services of Nevada is needed in our community. Since the start of the pandemic, individuals that had never experienced a mental health crisis were suddenly finding themselves in crisis. These past 20 months have shed new light on the importance of behavioral health. It's okay not to be okay. It's also okay to ask for help. And that's why we're here today, to secure that Crisis Support Services of Nevada can continue to support those who find themselves in crisis. Whether via phone or text, Crisis Support Services of Nevada is a lifeline. What is it like to experience a mental health crisis? What is it like to live with a behavioral health issue? Here to share her own personal story, we are honored to introduce our next speaker, Michelle Scott.
Good morning. Let's start with a deep breath to get us all oriented and settle my nerves. My name is Michelle Scott. In 2019, after 5 years, I completed school through my bachelor's in social work. In December of 2020, I got the job I had dreamed of in mental health. Since my teens, I have had mental illness. During the 5 years of school, I was hospitalized 3 times. The tenacity I developed through living with mental illness also got me through my hospitalizations and school. I was misdiagnosed most of my life. As a teenager, I was released from the hospital and told I was borderline and felt emotions too much and that I'd never get better. That didn't do much for my wavering desire to live. I was later diagnosed with severe depression, then seasonal affective disorder, and finally, when I was 35, I was correctly diagnosed with complex PTSD, bipolar, and anxiety. The first 2 times of being hospitalized in my 30s were drastically different from the third time, mostly because it was a different hospital. The first 2 times I was taken by the police from my therapist's office in handcuffs to the hospital to make sure I hadn't overdosed and lied about it. Once the blood work was done, I was taken to jail to wait for a bed to open. Let me draw you a picture. I was stripped of my clothes and given an itchy dress to wear, then put in a cell that had a mat on the floor and a metal toilet with no toilet seat. I stayed there for however many hours it took to get a room available, which once took all day long. Once a bed was available, I was given back my clothes, handcuffed again, and put back into the police car for the hour-long drive to the hospital. Once I arrived at the hospital, I was taken to a small room with 2 nurses and told to strip. Along the way, they nonchalantly marked down the cuts on my body, including the words of self-hate all over my thighs, in a very clinical manner. Then I was given clothes. All of my belongings, including my prescriptions and medications, were locked up. I was told I would receive no medications until the doctor saw me. The first time, it was the 3rd day before I saw a doctor. Think about that. I was already barely holding on, and my antidepressants were stopped cold turkey, only to be re-prescribed after 3 days at a higher dose. The second time I saw a doctor the morning of the 2nd day and was prescribed something for anxiety. Later, I asked for my 2nd dose and was told I was 20 minutes early. At that point, I was so anxious, I couldn't stand it. I went into my room, and with the door open, I ripped my sheet and tried to tie it around my neck tight enough to kill myself. When that didn't work, I punched the wall until I punched a hole in it, and was then yelled at by a very large man. It was the first time I'd seen anyone come out from the nursing station all day. It took everything I had and several minutes of breathing to get myself under enough control to walk away instead of fighting with him. The next day, when I saw the doctor, I told him I must be feeling a little better because I hadn't done either of those behaviors. There was no note in the chart. My top sheet and robe were taken away, and I was under observation by another large man in a chair at the front of my room and expected to sleep. After a while, I just went in the main room to get away from him. Both times I was asked on the third day, "So are you ready to go home?" Because I felt I wasn't worth the space, I said okay, even though I wasn't stable. My third experience was much better. I was allowed to drive to this hospital and check myself in for observation. I was allowed my own clothes, minus belt or strings. A doctor saw me within 12 hours, and the nurses checked the status of my mood and medication side effects twice a day. I don't remember seeing them behind the desk very much. I was never taken off meds or forced to wait for them. They adjusted them immediately. When they asked me did I need to stay longer, they worked with my insurance company to get me more time. And because of their compassionate way of asking, I was able to fight my lack of self-worth and say no, I wasn't ready to leave. The staff interacted with us. We were taught skills, allowed to go on walks, and even had art classes in the evenings. We had phone hours to talk to our loved ones. When I left, I felt anxious but ready to take on my life again. Since then, I found NAMI and started talking to other people with mental illnesses that function as nurses, CEOs, and therapists. I was able to let go of my self-hatred and lack of self-worth that had stuck to me because of internalized stigma. I finally believed I could follow my dreams and make a difference in life. I took a series of classes from Didi Hirsch to help facilitate a suicide attempt survivors skill building group, and also began working in the mental health field. Mental illness doesn't guarantee a life on the streets or in group homes. A full life is possible, but we all need non-judgmental and compassionate care to get back on our feet when we fall. Thank you so much.
Thank you, Michelle, for sharing your very personal story. You are shining a light on mental health. Often people in Nevada who are experiencing a behavioral health crisis are not being served in a timely, trauma-informed manner. Here to discuss how Nevada is moving towards building a crisis care response system that is supportive and meeting the needs of individuals. In crisis, please welcome Kelly Marshall, Principal of Social Entrepreneurs, Inc. and facilitator of the statewide planning of Nevada's behavioral health care crisis system.
Thank you, Connie. I'm so thrilled to be here with Compassion Through the Crisis and to talk with you about building a crisis response system in Nevada. So as you heard from Rochelle, a 988 crisis line is going live across the nation and in Nevada on July 16th, 2022. And we have been working really feverishly to build the crisis response system to ensure that everything is ready to go when that goes live. So what does a crisis line do? It connects a person in a behavioral health crisis to trained staff that can address their immediate needs and help connect them to ongoing care so that they can remain in the community. And you heard from Michelle about why that is so important. It also helps us as a community reduce healthcare spending, reduce the use of law enforcement or other public health or safety resources, and it will help us meet what has been a growing need for crisis intervention. Most importantly, it will help reduce stigma. For those who are seeking or accessing behavioral health care, they need to know that it's okay to ask for help and that help is available for them. So what does the crisis response system do? It gives you someone to talk to, that's the 988 line, but then also someone to respond. So if you cannot be de-escalated over the crisis line, someone can come to you and they can comfort you, they can talk with you, and they can talk about what your options are. And many people can be de-escalated in that way. But if not, then the third component is that you have somewhere to go. and that it's a warm, welcoming, living room-like setting that doesn't include restraints, that doesn't stigmatize you or traumatize you further, but actually welcomes you into recovery. And embedded through all of that are some essential principles and practices, or what we call best practices. And those include addressing the recovery needs of individuals based on their own particular circumstances, using peers, people who have been through the process themselves, as a support and as a guide throughout the crisis. And then the principles of zero suicide or suicide safer care, as well as trauma-informed care, need to be embedded throughout all parts of the system. We also are super concerned with safety and security for staff and the people in crisis. And so that is one of the principles that we use as we build the system. And we are reliant on partnerships. So we need law enforcement, we need dispatch, we need emergency medical services to also be available if the crisis is something that goes beyond what the crisis response system can manage. So if you think about the system as a whole, what we know is that we want to put the person in crisis first, and we want to give them easy access. So we want them to call that 3-digit number, 988, and about 80% of people who will call 988, that issue will be resolved over the phone. We also want folks who call 911 because they're more used to that number if it's not a police, fire, or ambulance type emergency to be transferred seamlessly to 988. If somebody is not able to be de-escalated, we want a mobile crisis response team with a clinician and a peer or another person who can assist to go to that person wherever they are. And really, 70% of the people that need that mobile crisis, they will resolve that issue right there in the field. For those that don't, we want that crisis stabilization facility. And we want it, as I said, to be warm and welcoming. And for police to also drop somebody off there if they determine this is not a police issue, this is not a medical issue, this is a mental health concern, so that that person can go into that warm living room-like setting and be stabilized in a comfortable way with peers and with clinicians. And we know that if we have those pieces and they work together, that a majority of people will be able to, with wraparound services, maintain and remain in our community as our friends, families, and neighbor. And if we do this right, we will reduce the use of emergency departments and jails. We're using the least restrictive environment possible, and it is less expensive. So really, we want to just keep that person in care, that person in crisis at the top of the pyramid. We want to support the community, and that includes family members, law enforcement, schools, other community partners. We want to employ clinical best practices because we know that works. And we want to provide an array of services and supports. We also want to have system oversight and governance. And so the crisis response system has been built with all of these components in mind. So if somebody were to say, what is a crisis response system? It's more than a single program. It is not just the crisis line. It is not just mobile crisis. It is that array of services working together to meet the urgent and emergent behavioral health crisis needs as soon as possible for as long as necessary. And so when we have that array, as we've designed and now are building that system, we want to distinguish it from the behavioral health system. It is not intended to replace the behavioral health system. It is to augment the behavioral health system. And so some of the things that we know is that staff has to be able to use advanced directives, know how to give crisis plans, understand the essential components that include formal suicide and violence risk screening and intervention. So there's a training component. And this is how we will get to a place that every person receives the right support at the right time in the right manner, and that they receive that for as long as they need to address that urgent or emergent crisis. So thank you so much for your time. It's a pleasure to be here. And if you have any questions, you can contact me at the email you see on your screen.
Thank you, Kelly, for highlighting the importance of the right care for the right individual. We know that to provide the crisis care that our state needs, funding is critical. And here to discuss the importance of funding, please welcome Senator Julia Ratty.
Hello, everyone, and thanks so much for being here today to support Crisis Support Services of Nevada. I'm really glad that you're here today to talk about the needed reforms to our behavioral health crisis response system. And I know you've learned a little bit about that here today. I'm here to talk a little bit about the legislative activity that happened to support this important work. I'm very excited to report that improving the way that we respond to a person who is experiencing a behavioral health crisis was a priority in our last legislative session, and it was a priority that received bipartisan support. You've heard that what we're trying to build is someplace to call, which is what Crisis Support Services does so well, someone who will come to you, a mobile crisis team, and someplace to go, a crisis support unit where you can get the services that you need to be fully supported if you're experiencing a behavioral health crisis. In building out that continuum, there are sometimes laws or money or lack of workforce that get in the way of us being successful. And so what we did in the legislature was try to address that. On the law side of things, we wanted to make sure that we had the right licensing structure for our crisis support centers. And so there was significant work at the legislature working with the Department of Health and Human Services to make sure that those centers are licensed correctly, that they have the right standards, the right infrastructure to be able to meet the needs of the people that we serve. There was another bill really focused on workforce. We've learned that we really get a lot of success when we have peer recovery support specialists who have that lived experience as part of a care team. And the crisis response model that we're trying to build integrates peers into every level. So whether that's on the phone or text or chat, whether that's on a mobile crisis team or whether that's in the crisis support unit. And so we did a lot of work on making sure that the credentialing process for peers and peer recovery support specialists specifically got the attention that it needed in this last legislative session, and that bill was successful. And then finally, perhaps the most important thing is we need money. And so we've been working with the state Medicaid system to build out specific rates for Medicaid so that when we're billing for these services, there's a sustainable funding source. But we know that Medicaid and other insurance often isn't enough to meet the need. And so we were able to pass SB 390. What SB 390 does is it creates a funding source. And so now, as that bill moves forward and gets implemented, there will be a fee charged on every phone line, and that phone line will go specifically to support the crisis response system. So in June of next year, when 988, the phone number that you can dial that will just dump you right into the right place that where you can get the support that you need, goes live. At the same time, we will be building a funding source to sustain these services over the long haul. And again, this was work that was a priority for the legislature. It was work that was supported, had bipartisan support, even when we talked about raising fees, which that's not always the case. But I think what I will say is that my own personal experience, the experience of so many people who do get elected to office and get the opportunity to serve is we all know someone personally who has been in a behavioral health crisis, whether that be a substance use disorder or somebody who's experiencing some form of suicidal tendency or suicidal ideation, or they just aren't feeling like they can continue to function. Then we've noticed that, of course, they don't always get the support that they need. And so when I started talking to folks throughout the legislative process about we need to do better, I had lots of folks who wanted to be involved and wanted to make a difference. So those are just a couple of the bills that happened during this next legislative session. with all of that said, we're still going to need additional support. We've got work to do. It'll take some time to stand up this model. Crisis Support Services Nevada is in a key critical role to make sure that it happens. And so we need everyone in this room and everybody you know to lean in. We need volunteers. We'll need more money. We'll need people to help educate the public on the different ways that we can make a difference. So again, thank you for being here. And thank you for being interested in how we do a better job of supporting our friends, our neighbors, the people that we love when they're experiencing a behavioral health crisis. Thank you.
Thank you, Senator Ratty, for your continued support to help our state find better mental health resources. Crisis Support Services of Nevada holds a very special place in my heart. I truly believe in the work that they are doing. Hundreds of thousands of lives have been saved because there was a toll-free hotline and text number with hope on the other end. A resource that was available 24 hours a day, 7 days a week, 365 days a year. We want people who are facing a crisis to know it is okay to seek help. I never want anyone to feel alone. I know that for many, the pain they feel or the crisis they are feeling is unimaginable. And I know unimaginable pain. On August 10th of 2018, my family's world was shattered when our sweet Katie, my 25-year-old stepdaughter, took her own life. Katie was a veteran, a mother of 3 young children, and a wife. Our world was completely turned inside out. The loss of a child is like having a piece of your soul torn out, never to be replaced. It's a pain that no parent should ever experience. Katie's suicide left us with so many unanswered questions. On the outside, it appeared that Katie had it all. She was beautiful, she was successful, she was deeply loved. But Katie struggled with mental health issues. At the time of her death, she had recently been diagnosed with postpartum depression. She had also experienced PTSD. She was a child who grew up with a biological mother who was an addict. Katie was struggling. She had even talked about suicide with a friend. She had also told her friend she would never do it because she loved her baby so much. But her pain was real. The suicide conversation was real. How could we have missed this? How could we have missed these important signs? Since Katie's death, I've worked with Crisis Support Services of Nevada, along with the Nevada Coalition for Suicide Prevention. I've since taken the Safe Talk Suicide Alertness Workshop. It is a brilliant resource that I encourage all of you to take. Because the more that we know about the signs of suicide, the more we can save lives together. Crisis Support Services of Nevada is saving lives. Because for anyone in crisis, or someone like our Katie, who may be having suicidal thoughts, they know that there is always someone there to listen. There is always someone who cares. Our family never thought that this could happen to us. We never thought that suicide would touch our lives this closely. We belong to a club that no one wants to be a member of. Katie is no longer here, but her memory will live on through her children and through this work. My family and I will never stop fighting for better resources. As you heard today, it takes a village. Together, we can expand services. We can provide better crisis resources to help those facing a mental health crisis. We can partner with agencies across the state to increase crisis services. Our village is worth it. Why should you make a donation today? Because you'll be part of providing 24-hour support to anyone facing an immediate crisis. Your support means that more people will get the much-needed care and support that they so vitally need in a moment of uncertainty. In my heart, I know that each time a call is answered, Katie is smiling because she knows that we're fighting for others. I believe the more that we continue to let our community know that Crisis Support Services of Nevada is a lifeline to help and hope, the more lives we will save together. Our village is worth fighting for because we matter, because you matter. Before we leave today, I'd like to introduce you to Leanne Pinguello. She is our board president for Crisis Support Services of Nevada.
Thank you for joining us today. I'm Leanne Pinguello, the current board president of Crisis Support Services of Nevada and the event chair for today's event, Compassion Through the Crisis. I am so passionate about this organization and our mission for many reasons, but foremost because they are here 24/7, 365 days a year for anyone in any crisis. And that anyone is me and you. I can safely say that all fellow humans who have lived through these past 2 years have experienced a major crisis. And whether you realize it or not, you may have PTSD, post-traumatic stress disorder. And before you dismiss my comment, let me read you the clinical definition of PTSD according to the American Psychiatric Association. Post-traumatic stress disorder, PTSD, is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, such as a natural disaster, a serious accident, a terrorist act, war, combat, or rape, who have been threatened by death, sexual violence, or serious injury. And there are 4 types of PTSD. PTSD symptoms are generally grouped into 4 categories: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. PTSD symptoms can vary over time and vary from person to person as well. And I'm here to say that person isn't just someone else. That person with PTSD could be you or your loved one. You or they may not even be showing outward signs of PTSD or even realize that what you're experiencing and feeling is PTSD. Everyone has likely experienced a mental health crisis at some point. And it doesn't have to require a trip to the doctor, medication, therapy to be considered a mental health incident or crisis. And in 2018, a mental health publication stated that 1 in 4 people will be affected by a mental health condition at some point in their life. And I would bet that today that number is even higher. So now you may be thinking, how would I determine if I'm feeling the symptoms of PTSD or having a behavioral health crisis, or if a friend, loved one, or colleague is exhibiting signs of PTSD? Or how would I recognize these signs of depression, anxiety disorder that maybe I'm seeing in my child or spouse? Well, these are all very complex yet serious and real situations that you and I will come up against. And obviously we are not therapists or doctors, and these are all very delicate topics to broach with someone, even if it's your closest friend and your loved one. Yet these are critical conversations that we must learn how to have with them. And this can be an overwhelming thought. I know it is for me. But it could save someone's life, and maybe it's the life of your child, your spouse, your partner, best friend, or your coworker. And I can promise you that there will be great regret and heartache no matter who it is if you have found yourself in the past saying, why? What could I have said to them? Why didn't I just say something? What did I miss? Why didn't I see it? Any of these words could haunt you for many years to come. But Crisis Support Services of Nevada is here to help you, so you never have to say or hear those words. And that is not just our hope, that is our mission. And it brings me great joy to be able to announce to you today a new program available to all in our community, and hopefully many in the future to come. This program is called Critical Conversations. When the stakes are high, tools for your emotional toolbox. This program will provide you with the tools and information that you'll need in order to recognize the precursors and signs of mental stress and even a crisis, and the tools to have when those difficult yet critical conversations need to happen with someone, and it could even mean their life. Our plan is to offer this program as a workshop or seminar type situation that'll be available to you at your place of work, within your network, or within what is your community. And our team of expert speakers will come to you or your office, either in person or virtually, and teach these valuable resources to your employees, students, or your children. Critical Conversations is a free program. Although, being a nonprofit, we do ask that you consider a donation to Crisis Support Services of Nevada. We hope you will take full advantage of this free resource and program that we've put together for our community. And frankly, why not? You may save a life by doing so. To schedule one of these powerful events, please go to our website, CSSNV.org, and select the events under the Get Involved tab. You will find the request to schedule this program, Critical Conversations, for your place of business or group. And the last thing I'd like to cover before I close today is the question of who and why someone should use our crisis hotline. The answer is anyone. Anyone that finds themselves in distress and struggling over any of life's difficult events or tragedies. It may be a breakup, getting fired, losing your job, or a medical diagnosis that you or a loved one received. And it may be that you're not the one directly experiencing the crisis, but you find yourself trying to help that person deal with that crisis or situation. Always err on the side of caution. You don't want to wait until it's too late, and now you're asking yourself, why didn't I call? We are equipped to connect you or your loved one with help and support for any mental or emotional situation you may find yourself in, or your loved one. I urge you to take a second, get a pen and paper if you have one, write this number down, and keep it in a very visible location, whether at work or at home. The number is 800-273-TALK, TALK. That's 800-273-8255. I would like to once again today thank the individuals who helped us make this event possible. There are so many staff, volunteers, and organizations that have come together so that we could provide this valuable information to you, our community, our friends, our family, and our neighbors. Thank you to Renown Regional Medical Center and NV Energy. They are this year's honored Circle of Compassion sponsors. Thank you to our other generous event sponsors this year. They are My Community Store, Solutions at Work, and Reno Behavioral Health, as well as all of the countless donors and supporters that regularly donate to us. Thank you. And to all of you who have joined us today, I humbly ask you to make a donation today and become our partner in this battle to ensure all Nevadans receive the proper care they need to overcome and live with their mental health issues. Our guest today, thank you to our speakers, Senator Catherine Cortez Masto, Senator Julia Ratty, Michelle Scott, Kelly Marshall, and our event host extraordinaire, Connie Ray. These talented and dedicated staff and volunteers who have worked tirelessly and diligently planning this event. Taylor Wilson, Kyla Willard, Rochelle Pellisier, Connie Ray, and the invaluable team of volunteers that currently oversees this organization along with me. Shannon Bell, Karen Jensen, Nicole Murray, Bob White, Robin Brocklesby, Krista Pepper, Jeffrey Clark, Rose McCow, and Micah Glover. I sincerely hope that next year we will once again be doing this event safely in person so that we can meet you face to face and share more exciting information on the progress of our collective battle in treating and supporting our community, Nevadans, and their struggle with mental health issues. I'd like to leave you with a challenge as you go back to the rest of your day. I challenge each of you over the next few days to go up to at least 5 other individuals, friend or stranger, who looks like they need to hear these words and say it with a smile. You matter.
You do matter. Thank you so much, Leanne. Critical Conversations, I'm so looking forward to being a part of this amazing program, and we thank you so very much for bringing these critical conversations to our community. Thank you for joining us for the 5th annual Compassion Through the Crisis virtual event. Thank you so much for supporting Crisis Support Services of Nevada and helping us make this event a huge success. You can make a donation anytime by visiting our website at cssnv.org/donate. Donate anytime, just like we are available 24 hours a day, 7 days a week, 365 days a year. Thank you again to Senator Cortez Masto and Senator Ratty for joining us, and for all of our wonderful speakers for sharing the importance of what we can do as a village to be there and support those in crisis. We hope to see you next year at the 6th annual Compassion Through the Crisis. Thank you again to our sponsors, Renown Health, NV Energy, Reno Behavioral Healthcare Hospital, and My Community Store. Thank you and have a wonderful day.